Move over kale smoothies. Ozempic's the new VIP in weight loss town. But why is everybody side-eyeing it harder than a suspicious burrito? Let's break it down. First off, what even is Ozempic? It's part of a fancy class of drugs called GLP-1 receptor agonists. Sounds sci-fi, right? Basically, they mimic a hormone which tells your stomach to chill out and empty slower. Translation, you feel fuller longer and your brain stops screaming, eat the whole pizza. Oh, and it also messes up your hypothalamus, which is the hunger part of your brain. So cravings, gone, poof, magic. Now, Ozempic's the diabetics version, but its sibling Wegovy is the weight loss superstar. Both are weekly injections because who has time for daily pills when you're busy scrolling TikTok? Speaking of TikTok, this drug broke the internet faster than the funniest cat meme. Celebrities are whispering about it, influencing are flexing their Ozempic bodies, and your Aunt Karen won't stop asking if you've tried it. But here's the kicker. It works in a 68-week trial. Wegovy users lost 14.9% of their body weight. Meanwhile, the placebo drug, a measly 2.4. That's like losing a whole chihuahua versus a hamster. No wonder Denmark's GDP got a boost from Novo Nordisk, the company behind Ozempic and Wegovy. Who needs oil when you have a weight loss drug that's basically printing money? And I use Wegovy and Ozempic, but all the GLP-1 drugs are that way. But wait, before you rush to your doctor demanding a prescription, let's talk about the elephant in the room, or maybe the toilet. This miracle drug comes with a side of, well, side effects. We're talking nausea, vomiting, and the occasional sprint to the bathroom. Oh, and let's not forget Ozempic face, because losing weight too fast can leave your skin sagging like a deflated balloon. So, why is everybody so obsessed? It's simple. Ozempic promises a shortcut to skinny, but like all shortcuts, there's a catch. Stay tuned as we dive into the good, the bad, and the downright weird about GLP-1 meds. Spoiler, it's not all sunshine and six packs. The GLP-1 gold rush, from science experiments to status symbols. GLP-1s are the new gold rush, but not everybody's striking it rich. Let's rewind a bit. GLP-1 medications didn't start the famous TikTok celebrity endorsed miracle drug that they are today. Nope, they began as a humble treatment for type 2 diabetes. Fast forward a few years and suddenly they're the hottest thing since sliced bread, which ironically you'll probably eat less of if you're on Ozempic. The market for these drugs is exploding faster than a soda can in a hot car. By 2030, the GLP-1 industry is expected to be worth a whopping $100 billion. That's right, billion, with a B. Novo Nordisk, the company behind Ozempic and Wegovy, is now as so big that it's carrying Denmark's economy on its back. Forget wind turbines and Lego. Denmark's new claim to fame is weight loss injections. But here's the kicker. While Novo Nordisk is raking in the cash, not everybody's getting a piece of the pie. These drugs cost nearly $1,000 a month. That's more than most people's car payment, car insurance, and Netflix subscription combined. And guess what? Insurances aren't exactly lining up to cover it. So unless you've got a trust fund or a side hustle selling artisanal candles, good luck affording your weekly dose of I'm not hungry. And then there's the shortage problem, with everyone and their dog trying to get their hands on Ozempic. Diabetics, the people that it's actually made for, are left scrambling. Imagine fighting your grandmother for the last box of Ozempic at the pharmacy. Not a pretty picture, huh? But the access issue that didn't stop at just your local CVS. In low and middle income countries where 70% of the diabetics deaths happen, these drugs are basically a pipe dream. It's like showing up to a potluck dinner with just a single grape and calling it your contribution. Meanwhile, in high-income countries, racial and ethnic minorities face their own set of problems and barriers. Systemic inequities mean they're less likely to get timely diagnosis, let alone access to these new fancy drugs. So, what's the solution? Some experts are calling for generic versions of these drugs to make them more affordable. Other, Others want their government to step in and negotiate better prices. But let's be real, pharma companies aren't exactly known for their generosity. It's like asking a cat to share its tuna. Good luck with that. And let's not forget the bigger picture. Even if we magically made these drugs free for everyone, they're not a cure-all. Obesity and diabetics are driven by deeper issues like poverty and food deserts, and lack of access to preventative care. You just can't slap a band-aid on a broken system and call it fixed. So, while GLP-1s are definitely a game changer, they're not the only game in town. We need policy changes, better healthcare access, and maybe a few less drive-thrus, but that's a conversation for another day. Why the hate? Side effects? Stigma? All right, let's address the elephant in the room. Why is everybody so mad at Ozempic? I mean, it's helping people lose weight, controlling diabetes, and maybe even making them live longer. What's not to love? Well, as it turns out, a lot. First up, the side effects. Oh, the side effects. If Ozempic were a person, it would be like that friend, great at parties, but always leaves a mess. For starters, 30% of the users reported having nausea and vomiting. That's right. Feeling full comes with a sprint of going to the bathroom. And let's not forget gastroparesis, aka stomach paralysis, which affects about 7% of users. Imagine your stomach deciding to take a vacation while you're just trying to enjoy a salad. Not fun. Then there's the bone and joint drama. Studies show that GLP-1 users have a higher risk of arthritis and tendonitis. So, congrats on losing 15 pounds. Now meet your new knee brace. And if that's not enough, there's the whole kidney stone situation. Turns out losing weight can make you forget to drink water, leading to dehydration. And you guessed it, kidney stones. Hydrate or dihydrate, folks. But wait, there's more. Let's talk about the thyroid cancer scare. Liraglutide, another GLP-1 drug, comes with a black box warning about thyroid cancer in the US and Canada. The European Medicines Agency, or EMA, says, it's probably fine, but still nothing like a little cancer fear to spice up your weight loss journey. And then there's the stigma. Oh, this stigma. If you've been on the internet lately, you've probably seen the term Ozempic face. Leaves your skin sagging and your face looking like it's melting. Celebrities are getting roasted left and right for their Ozempic glowdowns. It's like the universe's way of saying, yeah, I can't have it all. But here's the thing. Not all of the hate is about the side effects. Some of it is about people that are using these drugs and why. Let's be real. A lot of people taking Ozempic don't need it. They're not diabetics. They're not obese. They're just trying to drop a few pounds before beach season. Meanwhile, diabetics are struggling to get their hands on this drug because of the shortages. It's like showing up to a buffet and taking all the shrimp before anyone else even gets a plate. Not cool. And let's not forget the cost. At $1,000 a month, Ozempic isn't exactly accessible to everyone. It's like a luxury handbag. Great if you can afford it, but most of us are stuck with the knockoff versions. This has led to a lot of resentment, especially from people who feel like these drugs are just another way for the rich to get richer and thinner. So, why the hate? It's a mix of legit concerns, hello side effects, and bigger issues like access and equality. But here's the kicker, despite all the drama, GLP-1s are still flying off the shelf because at the end of the day, people want results, even if it means putting up with a little nausea. And there's hidden perks. Turns out Ozempic isn't just for shrinking the waistline, it's got some unexpected superpowers too. All right, let's break it down from the drama and the talk about the good stuff. Because, surprise, GLP-1 medications aren't just for weight loss and diabetes control. Nope, they're like the Swiss Army knife of drugs, with benefits that go way beyond the scale. First, let's talk about your brain. Yes, your brain. Studies have shown that GLP-1s can reduce the risk of dementia by 12%. That's right, these drugs might help you remember where you left your keys and drop a few pounds. Talk about a 2-for-1 deal. But wait, there's more. GLP-1 have also been linked to lower the risk of psychosis and schizophrenia. So not only are you losing weight, but you're also keeping your mind sharp. Who knew feeling full could help you feel smarter? And let's not forget about your heart. GLP-1s have been shown to reduce the risk of cardiac arrest and heart failure. That's like having a personal trainer for your heart, minus the awkward small talk. Plus, you can lower your risk of pulmonary embolism and deep vein thrombosis. Basically, these drugs are out there and they're saving lives while helping you stay fit and fit into your skinny jeans. But wait, there's more. GLP-1s are also helping with addiction. Yep, you heard it right. Studies show that they can reduce your cravings for opioids, alcohol, and even stimulants. So now, not only are you losing weight, but you're also kicking bad habits to the curb. It's like the AA meeting, but with fewer, less awkward group hugs. And let's not forget about the infections. GLP-1 users have a lower risk of pneumonia, sepsis, and bacterial infections. So while everyone else is down for the count with the flu, you'll be out there living your best life. But here's the kicker. Despite all these benefits, GLP-1s aren't perfect. Remember those kidney stones we were talking about earlier? Yep, they're still a thing. And let's not forget the dehydration risk. So while you're out there living your best life, don't forget to drink some water. Hydrate or dihydrate, folks. So what's the takeaway? GLP-1s are more than just a weight loss drug. They're a multitasking miracle with benefits that go way beyond the scale. But like anything in life, they're not perfect. So while you're enjoying the perks, don't forget to keep an eye on the risks. Experts' analysis. When it comes to GLP-1s, the experts are split, kind of like your family during Thanksgiving dinner. Let's get one thing straight. Not everyone's on Team Ozempic. While some experts are singing its praises, others out there are side-eyeing it harder than your aunt side-eyeing your life choices. So, who's right? Let's break it down. First up, the heroes. Leading the charge is Dr. Zayed Al-Ali, who's basically the Gandhi of GLP-1 research. His studies found 42 health benefits versus 19 risks. That's like winning a game in health roulette. He's all about the data, says the benefits outweigh the risk. But let's not ignore the side effects. Translation, Ozempic's great, but maybe keep a trash can nearby. Then there's Dr. Daniel Drucker, the guy who's basically invented GLP-1 science. He's not sweating the pancreatitis fears, calling them overhyped. According to him, the anti-inflammatory effects of these drugs are game changers. So while everyone else is panicking, he's chilling like, relax, it's fine. But not everybody's sipping the GLP-1 Kool-Aid. Enter the haters. Dr. Elizabeth Pierce is waving the caution flag when it comes to thyroid cancer. She's like, we don't have enough data to say it's safe. And she's not wrong. Liraglutide comes with a black label warning in the US and Canada. So while experts are struggling it out, she's saying, pump on the brakes. Then there's the equity advocates like Dr. Babu, who's all about fixing the root causes of obesity and diabetes. He's like, sure, Ozempic's great, but what about the food deserts and poverty? Basically, he's saying we can't just throw drugs at the problem and call it a day. And let's not forget the skeptics who worry about long-term effects. Sure, GLP-1s are helping people now, but what about 10 years down the line? It's like buying a car without checking the mileage. You might regret it later. So, who's right? Honestly, it's a mix. GLP-1s are a game changer, but they're not perfect. And while the experts are duking it out, the rest of us are just trying to figure out if we could afford our next dose. Do we have to sell our kidney? But hey, love or hate it, one of the things clear, GLP-1s are here to stay, and the new drugs on the horizon with the debates going on getting louder. So grab your popcorn, stay tuned, because this isn't over yet. The future? Less vomiting, more equity. The future of GLP-1 is looking good, bright, less nausea, more fairness. But will it actually happen? Let's dive in. All right, let's talk about what's next in GLP-1 medications, because let's be real, the current version is like the first gen iPhone, revolutionary, but kind of clunky. The next wave of GLP-1s, they're on the horizon, and it really looks good. First up, oral GLP-1s. That's right, no more needles. Companies like Novo Nordisk and Pfizer are working on pills that do the same thing as Ozempic and Wegovy, but without that weekly jab. It's like upgrading from a flip phone to a smartphone. And let's not forget the competition heating up. Eli Lilly has a new drug in the pipeline, and they're working on ones with promise of fewer side effects. Basically, the GLP-1 market is about to get a whole lot more crowded. And that's good news for us. But here's the thing. Even with the fanciest new drugs, it won't matter if people can't afford them. Right now, GLP-1s cost $1,000 a month, which is more than most people's car payment and Netflix subscriptions all in one. And while some experts are pushing for generic versions, pharma companies aren't exactly rushing to make that happen. It's like asking a cat to share its tuna. It's not going to happen. So what's the solution? Some are calling on government intervention, like tax breaks for companies that make an affordable version of these medications. So we'll see if that happens, but it's not going to happen overnight. And then there's the bigger picture. Even if we magically made these GLP-1 medications free for everyone, they're not a cure-all. Obesity and diabetes are driven by deeper issues like poverty, choices of food, lack of preventative care. You just can't slap a Band-Aid on it and call it fixed. That's why some experts are pushing for holistic approaches. Think better nutrition policies, more funding for preventive care, and maybe a few less drive-thrus. It's like fixing a leaky roof. You can't just keep mopping up the water. You've got to patch the hole. But here's the kicker. None of this is going to happen without a fight. Pharma companies aren't exactly known for their generosity, and governments aren't always quick to act. So while there's a future of GLP-1s that looks bright, it's not going to be easy. But hey, progress is progress. And with new drugs, better policies, and a bit of luck, we may just get there. So here's to the future of less vomiting, more equity, and maybe even a few less drive-thrus. And now, the moment we've been waiting for, the final verdict on GLP-1s. So the conclusions. So our GLP-1, is it the miracle drug that we've been waiting for, or just another overhyped mess? Let's wrap this up. Here's the deal. Medications like ozempic and Wegovy, they're helping people. They're helping with heart disease. That's huge. And on the other hand, they come with side effects. It's like a roller coaster. Nausea, vomiting, occasional kidney stones. Fun, right? Then there's the cost. $1,000 a month. That's a lot of money. That's like getting access to private jets. And let's not forget the shortages, which are leaving diabetics high and dry, while influencers are stocking up. But here's the thing. GLP-1 medications aren't going away. With new drugs in the pipeline and a growing demand, there's going to be bigger, ironically, and more stuff going on. So what's the verdict? Miracle or mess? Honestly, it's a bit of both. GLP-1s are a game changer, but they're not perfect. And while the experts duke it out, the rest of us are just trying to figure out if we could afford the next dose. Thanks for sticking around. If you've enjoyed this deep dive into the Wild West of GLP-1 medications, don't forget to like, subscribe, and hit that bell so you don't miss out on content. And you never know, you may actually learn something from this. So are you on Team Miracle or Team Mess? Let me know in the comments.